This vitamin is a water-soluble vitamin that is derived from animal products such as red meat, dairy, and eggs. It contains mineral cobalt, so compounds with these vitamins are collectively called as cobalamines. There are mainly four forms of cobalamins. They are methylcobalamin, 5-deoxyadenosylcobalamin, hydroxycobalamin, and cyanocobalamin. Have you guessed it? What I am talking about? Yes, it is vitamin B12. Let's learn about vitamin B12. Vitamin B12 is required for development, myelination and function of central nervous system, healthy red blood cell formation and DNA synthesis. Health benefits of vitamin B12. It nourishes the brain and nervous system and supports memory and mood. It may help with the skin, hair and nail health. It may lower the risk of heart disease by reducing homocysteine levels in the blood. Let's see the food source of vitamin B12. It is present in the foods of animal origin such as fish, meat, poultry, eggs and dairy products. Beef liver contains around 70 microgram per 3 ounces. Clams and oysters contain 15 to 17 microgram per 3 ounces. Salmon and tuna contains 2.5 to 2.6 microgram per 3 ounces. Milk and yogurt contain around 1.3 microgram per 1 cup. Cheese and egg, they contain 0.5 microgram per 1 ounce. This table shows age-wise adequate intakes per day for vitamin B12. Let's learn the symptoms of vitamin B12 deficiency. Vitamin B12 deficiency manifests as a macrocytic anemia, thus presenting symptoms and signs that are of anemia such as fatigue and pallor. Due to increased hemolysis, there are chances of formation of jaundice. It is also associated with peripheral neuropathy, glossitis, diarrhea, headache and neuropsychiatric disturbances. It can also cause subacute combined degeneration of spinal cord. A complete neurological examination is necessary to evaluate for dementia, peripheral neuropathy, ataxia and loss of proprioception. Now let's learn about how to test for vitamin B12. The specimen required for vitamin B12 are serum sample, which is either in plain tube or serum separator tube or lithium heparin plasma. Fasting is not required for this test. Laboratory findings in vitamin B12 deficiency. CBC shows macrocytic anemia, in which hemoglobin and hematocrit are decreased and MCV is raised. There is a hypersegmented neutrophil cell seen on peripheral smear. The other findings on peripheral smear are Cabot ring, Howell Jolly bodies, NRBCs, etc. Vitamin B12 status is typically assessed by measurement of serum or plasma vitamin B12 level. The cutoff between normal and deficiency varies by method and laboratory. The most laboratories define subnormal serum or plasma values as those lower than 200 picogram per ml. The normal level of vitamin B12 is more than 300 picogram per ml. In borderline cases where the level ranges between 200 to 300 picogram per ml, MMA and homocysteine should be evaluated. Methylmalonic acid is a most sensitive marker of vitamin B12 status. Now let's learn about methods of detection of vitamin B12 in clinical laboratory. They are microbiological assays, spectrophotometric methods, electrochemiluminescent immunoassay, ICP-MS, atomic absorption spectrometry, radioimmunoassay, HPLC and capillary electrophoresis. Among these, the microbiological assay and spectrophotometric methods are older methods. The electrochemiluminescent immunoassay, which involves competitive principle, is a main method in the clinical laboratory. Inductive coupled plasma mass spectrometry is a very important method which has an ionization source, mass analyzer and detector. Atomic absorption spectrometry depends on measuring the amount of energy involved in the reaction. Radioimmunoassay is a highly sensitive immunoassay technique. It is based on the reaction of antigen and antibody in which very small amounts of radio-labeled antigen competes with endogenous antigen for limited binding sites of the specific antibody against the same antigen. The HPLC and capillary electrophoresis are coupled with certain detectors. Together, they help us to measure vitamin B12. Reference range. Because differences may exist with respect to population and dietary status, it is recommended that normal ranges should be determined by each laboratory over a suitable period of time. Widely accepted reference range for adult is around 200 to 900 picogram per ml. In vitamin B12 deficiency, the initial treatment of choice is 1000 microgram of vitamin B12 intramuscular injection every week for 4 weeks, and after that every month. There are newer formations like sublingual vitamin B12 supplements are also available for vitamin B12 deficiency. So this is in short about vitamin B12. These are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.